Okay, hey, Dr. Nick and Hannah back here with you again from Elevation Spine. Now, with our series where we're demonstrating what a visit in our office may look like, I'm going to demonstrate an adjustment of the lumbar spine or the low back on Hannah. And so here's our spine, of course. Spine sits in you like this. Now, when we find restrictions in the spine, our job is to eliminate them, to create or to restore the normal motion to the joint. The old model that we had of spine care of chiropractic was sort of bone out of place, and then we put the bone back in place. We now know that's not really what happens. What really happens is, due to injuries and the inflammatory response that we get kind of this inflammatory soup that heals up injuries, whether it's a cut on your arm or a sprain in your back. That soup creates kind of this glue-like crosshatched tissue that we sort of colloquialize as scar tissue. And that tissue is actually, it's not very flexible, it's not as strong, and the other problem with it is that while it's necessary, it's got its own pain fibers in it. So when we have that sort of unaddressed, disorganized tissue, it creates problems and it's a source of pain for patients. So that's part of what we do to eliminate that. Now, back to the alignment thing, you can have bones be out of alignment, but typically that's going to be misalignment in terms of a global, meaning a regional sense, like say your neck, and in which case your whole spine is at rest or at your normal posture, which may be abnormal, is out of line. So I'm going to show an adjustment on Hannah's low back. So Hannah, would you please lay on your back, face up to start. And then what I'm going to do is I'm going to have you roll and face me on your side, please. Perfect, just like that. We'll bring this headpiece up just a little more. I'm going to bend your top leg and straighten your lower leg. And then I'm going to we're going to give you a little bit of a pull. Relax there, and then I'm going to scooch toward me a little bit. Okay, perfect. So what I'm going to do is I'm going to contact Hannah's L3, her third lumbar vertebra. There's actually 5. And then I'm going to adjust it in the area or in the direction that it's fixated or stuck. So what I'm going to do is I'm going to have Hannah just roll toward me. I promise I won't drop you. Let your shoulder just kind of fall back. That's perfect. Shoulder back. Beautiful. That went great.
Yep.
Let's adjust your other side. Perfect. Okay. Straighten this leg, please. I'm sorry, I meant bend. You knew what I meant. And then I'm going to scooch toward me, same thing. You can see Hannah's really big, hard to move around the table. And then I'm going to hold your shoulder just like that. And I promise I won't drop you. I'm just going to roll you into me. So shoulder back. It was moving on the setup. Very good. Come on up. That was a great adjustment. That's what a low back adjustment looks like. And at the risk of sounding redundant, don't try this at home, okay? Not amateur stuff. I've had patients come to me over the years and say, my friend adjusted me at a keg party, literally this is a story, around a campfire, and now my mid-back hurts. My first question is always, is your friend a chiropractor? Of course, the answer is no. In that case, this guy's friend broke his ribs. So don't do it. But do stay tuned for more awesome videos, and we'll be back at you.